Dr Tedros was first elected to the position in 2017, and Wednesday's election was a culmination of a process that began in April 2021 when member states were invited to submit proposals for candidates for the post of DG. The WHO Executive Board in January this year formally nominated him to stand for a second term. His confirmation comes despite Ethiopia declining to nominate Dr Tedros, who is Tigrayan, for a second term due to tensions in the country's northern regions, amid accusations that the DG was taking sides in that conflict, a claim he has consistently denied. He has also in large part been the face of the global COVID-19 response, making his a household name internationally.
As you know, this Health Assembly marks the end of my first term as Director General. I am humbled by the Executive Board's decision to nominate me for a second term.
He reiterated his position to the World Health Assembly that while many wanted to move on past the pandemic, that it certainly wasn't over yet.
It's not over anywhere until it's over everywhere. Reported cases are increasing in almost 70 countries in all regions, and this is in a world in which testing rates have plummeted and reported deaths are rising in my continent, the continent with the lowest vaccination coverage. This virus has surprised us at every turn, a storm that has torn through communities again and again, and we still can't predict its path or its intensity. We lower our guard at our peril.
Before being appointed WHO DG, Dr Tedros served as both Minister of Foreign Affairs and prior to that, of Health in Ethiopia, as chair of the board of the Global Fund to fight AIDS, TB and malaria, and as co-chair of the board of the Partnership for Maternal, Newborn and Child Health.
The pandemic is not the only crisis in our world. As we speak, our colleagues around the world are responding to outbreaks of Ebola in DRC, monkeypox and hepatitis of unknown cause, and complex humanitarian crisis in Afghanistan, Ethiopia, Somalia, South Sudan, the Syrian Arab Republic, Ukraine, and Yemen. We face a formidable convergence of disease, drought, famine, and war fueled by climate change, inequity, and geopolitical rivalry.
Dr Tedros will now serve until 2027 as the head of the UN's health agency based in Geneva, viewed as a steady voice throughout the pandemic that has also seen the organization he leads come in for criticism amid calls for change that led to the institution in March this year announcing wide-ranging reforms in an effort to modernize and strengthen the WHO as the world's leading authority on public health. Shervin Briceby's SABC News, New York.